Today we will be talking about beta-2 agonists. Beta-2 agonists and bronchodilators are the mainstay treatment for pulmonary conditions such as asthma and COPD. Depending on what needs to be treated and what stage the disease process is at, your treatment may vary. There are two main types: short-acting bronchodilators, which are used as a quick or emergency treatment, and long-acting bronchodilators, which are used to control. Beta-2 agonists bind to the beta-2 androgen which is present in the epithelial and smooth muscle cells of our airway. This binding starts a signaling cascade, ultimately leading to the relaxation of airway smooth muscle. A major step in the cascade is the increase of AC. This produces intracellular CAMP from ATP. Ultimately, contractility of the smooth muscle decreases, as well as the airway hyperresponsiveness. Primarily, beta-2 agonists and bronchodilators are used to relieve and prevent symptoms of asthma and other pulmonary disorders. First, we will talk about short-term use. Some patients may need to take their medication prior to exercising to avoid exercise-induced bronchoconstriction. Others may need to use their short-term rapid-acting medication during allergy season or when they're around pets. Prevention of exacerbations is a primary goal in treatment. Long-term therapies can help maintain this stability. Now we will discuss long-term uses. Long-term tobacco use leads to many of the pulmonary disorders, causing patients to need LABA. LABA and ICS, which is inhaled corticosteroids, are used as a dual long-term treatment to help keep patients stable, limiting exacerbations.
Contraindications of beta-2 agonist drugs. Do not take this medicine if you have hypersensitivity to sympathomimetics, also known as adrenergic amines. This group of drugs mimic the stimulation of your sympathetic nervous system, which can cause different side effects to your body. Also, because severe bronchospasm is life-threatening, indications to use these drugs outweighs more as opposed to not administering it. Be cautious when taking these drugs and let your provider know if you have these conditions, including but not limited to tachydysrhythmia, severe coronary artery disease, aortic stenosis, cardiac disease, renal disease, hyperthyroidism, seizures, ankylosing glaucoma, hypertension, and if you're diabetic, pregnant, and breastfeeding. Most of the drugs in this class are similar to each other, but due to their diverse pharmacokinetics, beta-2 agonist drugs can have different dosing regimen and duration of action that allows them to be more effective. These drugs are usually administered through inhalations in three ways: metered-dose inhaler, dry powder inhaler, or through a nebulizer which atomizes the liquid to mist. Through inhalation, the drug is transported directly to the lungs, thus reducing the chances of patients experiencing side effects. Another way of administration is by mouth in the form of tablet, aerosol, or syrup. These oral forms are used as prophylaxis and reversal of bronchospasm, most commonly used for asthma therapy. And lastly, it can be given intravenously through an injection. Out of the three administration routes mentioned, side effects are most likely experienced if these beta-2 agonist drugs are taken orally and intravenously because of the indirect route to the lungs. It's because these drugs are systematically absorbed in different parts of the body as it is being delivered to the lungs, affecting more of the sympathetic nervous system.
In the action of beta-2 agonists, we know that the distribution and metabolism effects are very important. Distribution. Beta-2 agonist turns to be an efficient inhaled delivery technique because it reaches the key target cell and has a low risk of systemic side effects. Beta-2 agonists target autonomic receptors on airways smooth muscle. Inhaled beta-2 agonists also interact with beta-2 receptors expressed on other important target cells. Metabolism. Beta-2 agonists extensively metabolize in the liver to inactive compounds. Hydrolyzed by compounds in liver tissue and blood to active compound. Beta-2 agonists can also be conjugately metabolized to other compounds. Beta-2 agonist has other mechanisms such as increased glucagon secretion and hepatic effects, which cause an overall increase in serum glucose and apparent decrease in insulin sensitivity.
Elimination. Elimination of albuterol is mainly renal. Elimination of salmeterol is not only kidney but breast milk. Elimination may be somewhat faster in children from 8 to 15 years old than in young adults. Factors that shape dose adjustments. Dose reduction should be considered if it is given together with inhaled cortisol steroids. Some evidence showed that inhaled beta-2 agonists and inhaled cortisol steroids have synergistic effects on vasodilation. Other factors could lead to dose reduction, the impaired renal function, because most of the beta-2 agonist is excreted through the kidney, or it will be given to children from 2 to 12 years old. Normal dose range. The dose for albuterol is 1 to 2 puffs by inhalation every 4 to 6 hours, PO 2 to 4 mg 3 times a day. Maximum dose 32 mg. The dose for salmeterol is typically 1 inhalation every 12 hours.
Now we will go on to patient teaching. What do patients need to know about beta-2 agonists? What information do patients need to know before, during, and after use of medications? The specific medications that we will be talking about are albuterol, which is a short-acting bronchodilator, and salmeterol, which is a long-acting bronchodilator. Common side effects may include tremors, anxiety, tachycardia, palpitations, seizures, nausea, and cough. The life-threatening adverse effect of albuterol is paradoxical bronchospasm, and the life-threatening adverse effect of salmeterol is asthma-related death. When administering albuterol with an inhaler, make sure to shake well before each use. Prime the inhaler by spraying into the air 4 times. Breathe out fully through the mouth, close lips around the mouthpiece, and breathe in deeply and slowly while fully depressing the canister. Hold breath for up to 10 seconds. If additional inhalations are prescribed, wait 1 minute after initial inhalation and shake the inhaler again before the next. At least once a week, the mouthpiece should be washed to prevent medication buildup and blockage. Before inhaling, breathe out fully. Do not exhale into the device. Activate and use only in the leveled horizontal position. Inhale quickly and deeply. Hold breath for about 10 seconds. Dispose the device 6 weeks after opening or after all the blisters have been used, whichever comes first. Salmeterol should not be used as a monotherapy. Take albuterol only as directed. Do not double the doses or increase the dose or frequency of doses because exceeding the recommended dose may cause adverse effects like paradoxical bronchospasm or loss of effectiveness. Make sure to report symptoms of paradoxical bronchospasm, which is mainly presented by wheezing. Contact the healthcare provider immediately if shortness of breath is not relieved by medication or is accompanied with diaphoresis, dizziness, palpitations, or chest pain. Notify the healthcare provider if there is no response to the patient's usual dose or if the contents in a single canister are used up in less than 2 weeks. Take salmeterol only as directed. Do not double the doses, and if symptoms occur before the next dose is due, use a rapid-acting inhaled bronchodilator. This medication is not indicated for acute asthma attacks. Immediately report severe asthma exacerbations and/or if the patient's condition matches one of the four below. It is also very important to have regular follow-up exams to determine progress during therapy. Peak flow measurement is important because it indicates the amount of air flowing in and out of the lungs. This will help determine when to get emergency medical treatment, how well an asthma treatment plan is working, when to stop or add medicine as directed by the healthcare provider, and what triggers the asthma attack. The healthcare provider will direct when and how to use the peak flow meter. In order to effectively use the peak flow meter, teach the patient these 9 steps. Prior to starting daily peak flow meter measuring, the healthcare provider may have the patient follow a detailed schedule for about 2 to 3 weeks in order to find the highest peak flow measurement. This value will be used as a baseline for daily measurements. Once the baseline is found, the patient will be able to figure out which zone their peak flow measurement falls under. There are 3 zones. First is green. This is a zone that the patient should be in every time. Second is yellow. This means that the patient should notify the healthcare provider. Third is red. This is a medical emergency. The patient should immediately seek help.
Nursing implications of beta-2 agonists. Nurses should be aware that short-acting beta-2 agonists, such as albuterol, are for acute attacks and are not used for prophylaxis. Long-acting beta-2 agonists, like salmeterol, are maintenance medications. They're scheduled drugs, and with time they may need to be given more frequently. Dangerous symptoms, such as tachydysrhythmias, angina, and seizures can occur when SABAs are taken in excess and could lead to cardiac arrest or death. Nurses should pay attention to how often rescue inhalers are needed, and if used more than 2 times a week, it may be necessary to alter the therapies used. Note that LABAs should be taken in combination with a glucocorticoid in patients with asthma, since LABAs as a monotherapy have been linked with increased incidences of asthma-associated mortalities in these patients. Before administering beta-2 agonists, it is necessary to assess lung sounds as well as vital signs like pulse rate and blood pressure. If the patient produces sputum, note the amount, color, and character of it. Assess peak flow readings if possible. Note serum potassium levels, since beta-2 agonists may promote hypokalemia. Monitor serum glucose values, especially in patients with diabetes, since beta-2 agonists can promote hyperglycemia due to beta-2 receptors being stimulated in the liver. During administration, make sure the patient is administering the medication properly. If 2 inhalations are needed, wait 1 minute between each. A major side effect of beta-2 agonists is tachycardia and palpitations. Use with caution in patients with cardiac problems due to the ability of the medications to stimulate beta-1 receptors in the heart. In these patients, assess heart rate and tell the patient to report chest pain or discomfort, shortness of breath, and palpitations. Other side effects of beta-2 agonists may include tremors due to the activation of beta-2 receptors in skeletal muscle. Tremors can be reduced by lowering the dosage of the medication. Other side effects may include seizures, anxiety, nausea, cough, hypokalemia, and hyperglycemia. After administration, the nurse should evaluate the effectiveness of the medication by conducting another respiratory assessment. Monitor for side effects. Take vital signs and observe for tachycardia, increased blood pressure, tremors, and chest pain. Observe for paradoxical bronchospasm, which can occur in some patients. Assess peak flow readings. Monitor potassium levels for hypokalemia. A decrease should be transient with SABAs, but may be longer with LABAs. Hypokalemia is due to skeletal muscle taking up potassium. This can contribute to cardiac arrhythmias and GI effects like constipation and cramps. Also, monitor glucose for hyperglycemia. These are important nursing implications for beta-2 agonists. Keep these implications in mind before, during, and after administration of these medications in order to ensure the well-being of your patient.
Created using Powtoon.